Hey guys, I'm Doug.
And I'm Theo.
And today, Theo is going to walk me through a recurring theme in my life and probably yours, which is indescribably bad, I'm not sure why it's there, wrist pain.
So if we learned with the elbow, Doug is pretty stiff in his wrists. And when you talk about the elbow, they are really the same because the muscles that attach up here, they connect down into the hand. We also know that the wrist is sort of like the ankle. It should be pretty flexible, but where did life take you? Maybe your job has stiffened your wrist. You're using your wrist in certain ways. Maybe you've had a couple of foosh injuries, which is when you fall on an outstretched hand. So in the last video, we discovered that Doug is extremely restricted in his wrists when we were addressing some of his elbow issues. And much like the ankle, the wrist will stiffen up if you sprain it so that the ligaments become extremely lax and they're no longer stable. The muscles will stiffen up, but also just through overuse, whether it's a job demand, if it's hobbies, if it's recreational activities, you can definitely stiffen through the wrist if you're working on grip strength. But again, we're not going back and helping those tissues elongate. So we know about hip mobility is a thing, ankle mobility is a thing, wrist and elbow mobility is a thing. So it's okay to work on these things, but if we're not helping the body recover, we lose the ability to sort of do those things, which is why somebody that might fall on an outstretched hand and land hard, they may be more vulnerable than somebody who actually has adequate range of motion because they had a little bit more room to give to kind of dissipate that impact.
So you're saying people who have strong grip strength but a lack of mobility are more vulnerable to
injuries,
falling on outstretched hand injuries?
Yeah, that and under the bar, because I've seen a lot of tearing to this tiny little ligament right here, which never happened 12 years ago. So, you will see some very strong individuals.
Thank you, Dmitry Klokov.
So yeah, it's common. It's just like anything else we see in the body. If the tissues are overused and not addressed and not restored through their proper range of motion, then yeah, we set ourselves up for an injury, even though we've been doing predominantly the right thing, like you're training, you're taking care of yourself. So it does happen, but unfortunately with the wrist, it's not fun because having a 5-pound protocol for 2 months after having some kind of surgical repair, it's pretty limiting in the world of just day-to-day living.
How are we identifying this? Like, what are ways we're going to mitigate that? And once the pain starts, how do I make it go away? Because for me, the pain is always, it feels like it's something that happened during an acute injury that I can't shake, but I know that it's not an acute injury. It's not something that I did because I bench pressed. Yep. I showed up at the gym one day, I got under the bar, and all of a sudden, my wrists just hurt. And now push-ups, bench press, any sort of like planar pushing motion is just like me adjusting the angle, trying to figure out where I can put my hands without there being excruciating pain in my wrists.
What he just said highlights most injuries because a thing happened, you didn't do those activities, which is the right thing to do, but this is also where consulting with a professional is really important because your body will just get rid of whatever it's not using. If you are not able to get your wrist back into that position because it hurts, well, you stop doing it, which is okay because you're letting that area heal. You're removing the kind of like the noxious, painful stimulus. But if you don't work to rehab that, your body, again, it gets rid of that motion. So you'll scar down. You'll see people in the injuries to the shoulder where they fell on it and they could not raise their arm over their head. And then 2 months later, there's no pain, but then they can't get past here. They can't get past here. So yeah, you have to be careful with just saying, oh, this thing happened a long time ago and now it's stiff, but I'm just going to drive on, because if you don't get that range of motion back, we're going to be overloading other areas, especially just north of the wrist. That area, this little bone that sticks out here, those ligaments that attach there, you could actually start to tear some of those muscles up here because there's a kink in the chain here. So yeah, be careful with going from, I did a thing and I diagnosed it on my own and I self-addressed it and then I'm just going to go back without talking to a professional, because in the wrist, we see that a lot.
So what are the things that we're going to do to A, ensure better mobility on our wrists, and B, maintain mobility as we heal from a pretty typical and common injury? I mean, wrist injuries are like not just because of masturbation anymore.
Well, really, if you're addressing the wrist, you're addressing the elbow. So everything we were talking about with the elbow, that's helping the wrist. There are some self-mobilizations you can do to the wrist. The way really the wrist has 2 rows of bones. The first one, that's going to move the opposite direction that you move your hand. So if I blocked here, if I had my kind of weight on my hand on the ground and blocked just off the edge of my wrist and rocked back and forth, I could mobilize my wrist to open up and get into that front rack position. So the distal, or like the furthest row, will follow the hand. So if I'm, blocking with my thumb and I'm doing some kind of like self-mobilization, I mean, again, I can manipulate the proximal row is
So
going to...
you're basically touching below your knuckles here and applying pressure, and then the other place is just below the wrist bone.
Yeah, so again, I could mobilize the row closest with my thumb underneath, but then I could put my hand on the second row, which is furthest, closest to the fingers, and I can get like a twofer here and just kind of mobilize, pushing up with my thumb, pushing down with my finger, and now I'm actually mobilizing those rows in the direction they should go. So it shouldn't hurt. If anything, it's just a good little stretch through the top. Again, if this is something where you fell hard and it's immediate, and just moving your hand or just putting pressure in some of these areas is sharp and painful, it's like, yeah, those are, stand down, like go talk to somebody, make sure you're not getting weakness, numbness in the hand. The wrists can be pretty complex. If you had an injury where you fell hard on your wrist, that's not the time to go and try to figure it out on your own. You do want to have a provider look at it, maybe order some films. A lot of the wrist injuries we see, they can be addressed with the elbow portion that we discussed. So if you are doing some of those light stretches and it helps, perfect. But with the wrist, it is a little more complex. So don't feel like you need to be chasing a lot of this stuff on your own.
Guys, if you're experiencing recurring pain in your wrists when you load them up, maybe it is overuse or maybe it's something more traumatic. Either way, you and me are not the people to consult on this. So make sure that you are going and seeing a provider, and make sure that you're taking care of yourself, because your wrists and your fingers are probably the most important thing that you're dealing with in your day-to-day job. And if you can't use them, or you can't actually produce any sort of power or pick anything up, you're pretty much useless. So we can do some rehab stuff like Theo and I talked about, but the reality is this is one of those things where if it's recurring pain and it's acute and it came from some sort of trauma or even came from overuse, you're still gonna have to go see a provider. So just go early, go often, get some professional consultation so you don't have to think about it when you're laying in bed at night.
If you guys found this content helpful and have any more questions, you can reach me at @TB_physio on Instagram.
And if you like this video and want to see more content like it, click subscribe, ring the bell, and leave a comment down below. We'll make sure to say something snarky in response.